Hi, my name is Haley and I'm going to be measuring a infant's head circumference, an infant's chest circumference, and the infant's length. First thing I'm going to do is start off by washing my hands. I use a towel to turn on my water. Circular motion. Turn off the faucet. Okay. So now I'm going to get my tape measure. Child is laying on the table. I'm going to talk to my infant as I'm starting to perform. Okay, friends, I'm going to be measuring your head. So I'm going to put it around the front. Make sure my zero is in the front of the forehead. Okay, the occipital. Here. Pull it nice and tight. Okay. Oh, so baby's head circumference is going to be 15 inches. 15 inches. I'm going to go ahead and record that in the patient's medical record. Once I am done, I will rewash my hands. Next, I'm going to be recording the infant's chest circumference. So keeping baby in the same spot. Just letting baby know and parent know that I'm going to be measuring the chest. And when you do this, you want to make sure the child is undressed, nose closed in the way, so you can get a good accurate measurement. You want to have the child raise up your hands here, and you want to make sure when you're going to do this that your zero is like in the mid, in the sternum here, and in the front. Okay, so now that I got my tape here, I'll make sure we're zero. Chest circumference is going to be right even at 13 inches. So I'm going to document that. Record. Okay. Now that that is done, and now that I have recorded the measurement and it's in the patient chart, I'm going to wash my hands. So now I'm going to be measuring an infant's length. So I would wash my hands again. I'm going to explain my procedure to the infant's caregivers. I'm just going to be measuring the length of the child, and then if the child has shoes on, which this one does not, you would just request for them to remove the shoes. So now what you would do is you would lay the infant on their back. For my sake, here in our office, we have table paper. You would lay against, if the baby was on a table, you would lay the baby against like a headboard and like pull baby's leg straight against the footboard. Unfortunately, my baby does not have that, and I don't have a headboard or footboard, but I do have table paper. I would move the infant's head back to the headboard all the way, slide my footboard, and measure. But in this case, while baby is laying here, pull leg straight, measure baby's heel into the crown of the head, measure. Alright, so now that baby is on the table and we've got that recorded, we go ahead and measure 0 at the head. Line is at 0. Okay, baby is exactly 18.5 inches long. So I'm going to record 18.5 inches. Okay, so I would ask the parent to please pick the child up and to please get the child dressed. Once the child has been given back to the parent and the measurements are recorded, I will wash my hands. Turn off the water, and I would document my measurements in the electronic medical record. And if I were to be like, I would also put it in the growth chart and give it to the parent.